Prostatectomy. Whenever you work with patients in your third and fourth year rotations on surgery, you're going to have pre-op studies, blood tests, EKGs, x-rays. This is this fellow's EKG before he's facing prostatectomy, and you're on the cardiology service, and Justin is on the surgical service, and he doesn't want to send this guy to the OR because he's worried about his EKG. So who is going to be my cardiology? Who's going to be on a cardiology rotation? Randy.
Oh.
Okay. Yeah? Yeah?
Sure.
So, is it a regular rhythm? What do you look at? And you can get help from your friends.
You've got.
What do you look at to determine if it's regular rhythm?
See if there's a P.
I'm just not asking about normal sinus mechanism. I just want to know if you took this fellow's pulse, would it be regular? And why? So I hear RR intervals. So if you took this fellow's pulse, you're feeling the RR interval, right? You're actually getting the rate of the RR interval. Every time you see a QRS, there's going to be a pulse, hopefully, unless there's a blood clot in his radial artery. So we look at the RR interval, and we see the rhythm strip below, and it looks like the rate is about what?
150.
Yeah, slightly 150 or so. That'd be close. So he's tachycardic, right? So, well, all of a sudden you're getting concerned, and Justin's right to keep him from going to the OR. All right. What about is it normal sinus rhythm?
It is a sinus rhythm.
What do we look for? What are the criteria for normal sinus mechanism?
P-wave.
P-wave before every QRS, normal QRS in terms of interval,
QRS after every P.
and RR intervals are identical. So Jeremy says this is normal sinus mechanism, right? Cool. What about the axis? All right, we look at lead one.
Axis.
I don't know if you can see this from the back or not. We look at lead one, and what is it, positive or negative?
It's positive.
So most of the deflection, most of the potential change in lead one is upright. Most of the potential change in lead one.
There's arrows on the right
Bottom
side.
right.
Yeah.
One more. There it is.
But it's still not going to let you run on it. You've got to do it as a,
I
like,
think it's
view
because
it
of the
as a
share.
PowerPoint or whatever.
Let's do it over here. Bottom.
Bottom right. Keep the, there you go. Yeah. There it is.
Okay.
Potential changes in lead one are upright, positive. So I'm out this way, right? Lead one is positive leftward, negative on this side. Now look at AVF. Not quite as impressive of a positive potential change in lead F, but it's still positive, right?
Yes.
So most of my vector is going toward lead one and not so much to lead AVF. So my axis is somewhat up here, but still in the normal quadrant, right? So he doesn't have any axis deviation. He's heading toward lead one more than lead AVF, but he's still in a normal quadrant. So there is no axis deviation. That would be a normal axis. All right, good.
That's right.
Anybody see anything in the, how about R wave progression?
R wave.
In V1, we have mostly S waves there. In V4, we have mostly R wave. So there is R wave progression here. There's very little R wave here, more R wave here, more R wave here, more R wave here. So there is R wave progression. Look at the T waves.
Inverted. Inverted.
Yeah, so we said, what about T waves? They should follow the direction of the T waves. So there's something going on there, and we'll see that in a little bit. So this is not a normal EKG, and Justin has reason to be concerned.
Dr. Feit, can you say that's normal sinus rhythm if his heart rate is 100 150 when you said sinus tachycardia.
Sinus tachycardia is what I would say. So if you're on rounds 2 years from now and your resident asks you what the EKG showed, said it is a sinus mechanism, but it's a sinus tachycardia. All right? So the pacemaker is still working. The SA node is initiating the cardiac cycle, but it is a tachycardia. Where's the axis here? One is
Down.
It's negative.
negative. AVF is positive. So we have right axis deviation here. We don't know why yet. We have to ask our patients some questions. But this is right axis deviation. Look at AVR. AVR is looking from the right shoulder. We know that atrial depolarization heads this way. We know that ventricular depolarization heads this way. Both depolarizations are away from the reviewing electrode, so I should see
Negative.
negative P, negative QRS complex, and negative T wave. And what does AVR show us? Don't see much of a P wave. There is a little P wave there, but I've got a positive QRS complex and my T wave is positive. So something's screwed up here, right? Look at my R wave progression. Look at V1 and look at V4 and 5. R waves are bigger in V1 and 2 than they are in V4 and 5, right? So there is no normal R wave progression. What might be going on here? I'm seeing a right axis deviation, and I'm seeing more R wave in my right ventricular leads than I am in my left ventricular leads. QRS interval is the QRS interval normal or not? Less than 3 small boxes, less than 0.123. So depolarization through the ventricles, I can say, is what? Normal or abnormal? Normal. QRS is not wide, and there's no delay there, so it's not a bundle branch block. What if I told you I put a stethoscope on the left chest and I didn't hear heart sounds?
Wow.
Put it on his right heart and I hear a nice,
Dextrocardia.
this guy's got dextrocardia. All right? That's why AVR is messed up. Now my ventricular depolarization is going toward my right shoulder, and that's why it's positive, as opposed to being in the left chest going away. The other possibility is that you guys put the leads on wrong, so we switched right. Did you get that?
We all three got the right answer.
Did you do that upstairs, put the leads on wrong? All right. So if the EKG technician puts the right arm on the left arm and vice versa, then I'm going to see the same thing. I lost my thumb drive this morning, or I didn't bring it. I had a picture of the dextrocardia on chest X-ray. So this guy actually did have dextrocardia. All right. So what do we see here? This is just a cartoon.